Welcome to today's webinar, What's New with Go Slow Whoa and Why? My name is Brooks Ballard and I'm the Vice President of Communications and Technology at Catch Global Foundation. And we're excited to have two great speakers with us today. Before I hand things over to them, I'd like to cover just a little bit of housekeeping first. So today's webinar is a co-production of Catch Global Foundation and the Michael and Susan Dell Center for Healthy Living at the UT Health School of Public Health in Austin. Sorry, I often fumble that name even though that's where I used to work. So as with all of our webinars, we want to encourage attendees to ask questions of our panelists and take advantage of the live aspect of the webinar format. So you can submit your questions, as I've seen some people already have, into the control panel on your screen at any time. But to keep things moving, we're gonna hold off on answering those until the Q&A portion of the webinar after the presentations. If you have any technical issues or problems, you can type those into the question box as well, and we'll do our best to help you out. The majority of technical problems, though, are solved by simply leaving and rejoining the webinar. I'll go ahead and answer the most common first question and tell you that today's webinar will be recorded and archived on both the Catch and MSD Center websites, along with a PDF of the presentation slides. Everyone who's registered for this webinar will receive a link to that archive and other resources automatically in their inbox. So keep an eye out for that tomorrow. So with that, I will move on to introduce our panelists today. So we have Professor Deanna Hoelscher of the UT Health School of Public Health and Joey Walker with Catch Global Foundation. Deanna, I do want to congratulate you. You finally did it. You have more letters after your name than in your name. So that's quite an accomplishment, but just gives everyone an idea of how prestigious of a speaker we have today. So Dr. Hoelscher is the John P. McGovern Professor in Health Promotion and Behavioral Sciences, the founding director of the Michael and Susan Dell Center for Healthy Living, and the Regional Dean at the UT Health School of Public Health in Austin. A registered dietitian nutritionist licensed in Texas and a certified nutrition specialist, her research interests focus on teaching children and their families how to engage in healthier behaviors to avoid the development of chronic disease, with a special emphasis on low-income and diverse populations. Her work includes research in child and adolescent nutrition, school and community-based health promotion programs, dietary assessment methodology, evaluation of child obesity policies, linkages between primary care and public health, and dissemination of school health programs. Dr. Hoelscher was president of the International Society of Behavioral Nutrition and Physical Activity, or ISBNPA, from 2012 to 2013. She was elected a fellow of ISBNPA in 2015. Currently, she serves as a member at large for the Obesity Society and has held positions at the Academy of Nutrition and Dietetics and the Society for Nutrition Education and Behavior. She has been the principal investigator of many projects with community-based components, including the Texas Childhood Obesity Research Demonstration Project, or Texas CHORD, funded by the CDC, Lunches in the Bag, funded by NIH, the Texas Childhood Obesity Prevention Policy Evaluation Study, funded by RWJF, and several different studies to develop and evaluate the school-based coordinated approach to child health, or CATCH program. So welcome, Dr. Hoelscher. Joey Walker is the curriculum director and training manager at Catch Global Foundation. She's a Catch Master Trainer and has helped initiate successful Catch projects in school districts and communities of every shape and size around the country. Joey has a background in academic research projects and has been instrumental in the development and testing of multiple Catch components. See if you recognize any of these. Joey served as the project director of the Texas CHORD project, and she also served as project director of Lunches in the Bag. She was also project director for the Dell Catch Elementary Travis County project, of which Dr. Hoelscher was the principal investigator, and was intricately involved in facilitating the implementation of Catch in elementary schools, both in Travis County and around the country. So welcome, Joey. So that's today's speakers. I'm going to hand it over to Dr. Hoelscher, who's going to get us started today.
Great. Thanks a lot, Brooks, and thanks, Joey, for joining me today in this webinar. It's always fun to get to talk to people about something that you've spent a lot of time doing and kind of give you a little bit of the why behind it. So let's get started. So today we're going to talk about the Go Slow and Whoa list. And so this is an integral part of the Catch curriculum. And it was designed as a tool to guide children and their families about making healthy food choices overall. The primary message is that foods can fit into a healthy diet, and that a healthy diet consists of primarily go foods with fewer slow foods and even fewer woe foods. So this kind of gives you an idea of how many you consume each day. So just a few words about putting together a list like this. Number one, there are many inherent challenges in putting together a list like Go Slow and Whoa. So one of the initial challenges is that nutrition is complex. So it's a complex science, it's evolving, and our task is to make it easy for children to understand it. And a lot of times children, especially those in the lower grades who have very concrete ways of thinking, you have to be careful about how you present these concepts. The second challenge is that foods are complex. So it is impossible for us to list every food that someone might consume. So what we try and do is get more of the basic foods listed, those that kids consume quite a bit, and have that as the basis of the list. We do understand that not all foods are on the list, though. It's impossible to kind of cover all of them. The third inherent challenge is that this list, it is primarily oriented toward primary prevention. So because of that, it has to accommodate a lot of different eating patterns. So we all have different food preferences and food choices, and then many of us have different nutrient requirements as well. So some of that will come up as we talk about the new changes in the Go Slow and Whoa list. So a little bit about the philosophy and the nutrition rationale behind the Go Slow and Whoa list. First of all, we want to emphasize whole, unprocessed foods. We previously revised the Go Slow Whoa list in the early 2000s, and that was something we did, but with this round, we even took it a little bit further. The second kind of underlying nutrition philosophy for this is that it does reflect state-of-the-art nutrition knowledge. Now, saying that, there are new studies that come out every day, but we really look at the preponderance of evidence and try and keep it in line with this. The third rationale behind this is the focus on primary prevention, as I mentioned before. So we're really focused on population-wide recommendations. So it's not necessarily a weight loss program, but it's focused on good eating habits that could be applicable to everyone. And then finally, this is nutrition for children. So we really consider growth and development in the development of this list. So a little bit about the categories. There's 7 categories in the Go Slow and Whoa list. Vegetables, fruits, grains, dairy, meats, beans, and eggs are protein sources, oils, which includes both oils and foods rich in oils, and then others, which are mainly condiments, herbs, and spices. So just to show you what the list looks like, many of you are familiar with it, but those of you that aren't, here's an example from fruits. And so I'll show this again in a little bit. But basically what you see is that we have a category under fruits. So for example, we have fruits and fruit juice, and then dried fruit, fruit leathers are 3 categories. And then as you go across, we have different foods classified as to whether they're go, slow, or whoa. So you'll see this for meats, you'll see this for dairy, where we do have go foods in almost all of the categories. We do have slow foods, and then we do have whoa foods. So this represents, even though we're not using the food guide pyramid anymore, I think that this diagram kind of really illustrates the proportionality of the foods that you eat every day. So if you look at the bottom, the base of the pyramid, those are go foods. So they should provide the base of what you eat every day. And so these are the foods that are lowest in unhealthy solid fats across a category. I showed you the categories in the previous slide. They have no added sugar. They're whole grains, vegetables, fruits, and lean meats. The slow foods, which you have fewer of, are higher in unhealthy solid fats and added sugars, and they tend to be more processed as well. The woe foods, which you should have the fewest of every day, are highest in unhealthy solid fats and added sugars. And these are, sometimes they're referred to as ultra-processed foods. So these are foods that look very different from maybe what they originally started out as. So why did we choose to update the Go Slow and Woe list? It's been an important part of the Catch curriculum. And so it's important that it represents the updated science. And so that's the primary emphasis behind this. But just to give you a little bit more clarity on that, this came from a report that just came out like a day or two. It's fresh off the press. But it's from the World Obesity Foundation, and it's a Childhood Obesity Atlas report. And childhood obesity is still a public health problem. It seems like we haven't heard as much about it in the popular press or in the media as other health problems recently. But if you look at this atlas, one of the things they did was they predicted the number of children with obesity in 2030. So they ran some models and did some predictions. And if you look here with the country and the number of persons with obesity aged 5 to 19 in 2030, the United States is going to be third in the world. And it's going to have almost 17 million kids between the ages of 5 and 19 with obesity. And they only lag behind China and India. So as a percentage, they might not be the highest. There are a lot of smaller countries. But when you look in the sheer numbers, that's an incredible number of kids. We do know that obesity tracks over time too, which means that these kids, they're likely to have obesity as adults. So this is really something we need to pay attention to. I know in Texas, where we have approximately 1 out of every 10 kids in the United States, this is almost 2 million kids you're talking about in 2030. So really an issue we need to pay attention to. The other thing is we know that children have unhealthy diets. So these are data from our Texas SPAN survey that was conducted in 2015-2016. So if you look at the x-axis, it shows the grades. So we've got grade 2, 4, 8, and 11. So we tried to measure kids at elementary, middle, and high school ages. And then if you look at the y-axis, it's the percent of children who reported. This is consumption of sugary beverages. So this includes fruit-flavored beverages as well as sodas. It does not include fruit juices. So if you look at this, one of the things you see, especially in 4th, 8th, and 11th grade, is that about 60% of kids drink at least one sugary drink per day. And if you look at the red bars, about 10% consume 3 or more sugary drinks a day. So we know that that's not an unhealthy, that is an unhealthy dietary habit, and that's something we need to address. One more slide about unhealthy diets in kids is this one kind of highlights the consumption of sweet and savory snacks by students in Texas. So again, if you look at 2, 4, 8, and 11th grade, one of the things that amazed me is kind of the consistency across the grade levels, but between about 35% to 40% of kids report consuming 3 or more snacks 3 or more times per day. And those include candy, frozen desserts, cakes, French fries, chips. So these are the foods we really want kids to minimize, and it looks like instead they're really a significant part of their diet. Another reason that we changed the Go Slow and Woe list is that nutrition research evolves. And like all good science, things change over time. I know a lot of people, it tends to be confusing, and people keep talking about how nutritionists need to make up their mind. I do think that that's an unfair criticism of the science. As in all fields, things change. A lot of our basic tenets of nutrition have remained the same. So nutritionists, as long as I've been in the field, have promoted fruits, vegetables, whole grains, so those messages are still consistent. but yet you want to address the newest research. So this is one example of some research that comes out that kind of supports what we're doing with Go Slow and Whoa. So in this research, they looked at ultra-processed foods compared to foods that were not processed. And so ultra-processed foods is defined in this study, which was conducted by Kevin Hall and published earlier this year, include sodas, salty snacks, ice cream, frozen pizza, chicken nuggets, instant soup, and fruit drinks. So a lot of the things you'll see on our WOA list. So what they did was they took 20 people and they did a crossover design, and they looked at consumption of ultra-processed foods versus unprocessed foods for 2 weeks. And one of the results from the study is that they found that when people were consuming the ultra-processed foods, they consumed 500 more calories per day. And there was a 4-pound weight difference at the end of the 2-week time period. So this really is in line with what we're trying to do with nutrition with the Go Slow and Whoa list. The other thing I think that's important to understand is when we began Catch, the science has evolved during that point as well. So when we began Catch, there was a lot of focus on growth and development on children rather than obesity per se. And as we've gone forward, there have been a lot of environmental factors that have contributed to obesity. So that's another area in which the research has kind of guided the Go Slow and Whoa list. So one of the things we first did was we conducted a survey, and so this was sent out through a Catch newsletter. It was kind of to start this process. And so we got 68 responses, and most of them came from New York. We also had a lot from Ohio, and then from Texas, and then from other states as well. I didn't list them all here. I just listed the top 3. So we asked, what did you like best, and what did you like least? And then suggested changes. So what they liked best was that it was easy to use. They thought it was simple, effective messages. It was easy to understand and catchy language. So couldn't resist putting that in there. What they liked least was 14 actually said it wasn't applicable, which was very nice to see. 10 said nothing, not sure. 9 talked about foods being in specific categories. So they disagreed with where the foods were categorized. And then 8 is how foods were categorized as well. So those two are very closely related. We also, in doing the Go Slow and Whoa list, we also had a review of about 8 dietitians and nutrition experts who kind of looked at the list and gave us feedback on that. So there's really thank yous to a lot of people, the people who responded to this, and in particular, I want to acknowledge Jerry Berry, who did a significant amount of work on getting this changed. So really want to acknowledge her efforts on this. So these are the overall changes in the new Go Slow and Whoa. We put more emphasis on processed versus unprocessed food. So more unprocessed foods were Go foods, more processed foods were Whoa foods. We also emphasize sugar content. So with the emerging science, we really were focusing on pushing foods that had sugar in them to Slow and Whoa list. We also focus less emphasis on fat for some foods. So kind of the way that we operationalized this was to see unhealthy solid fats as Whoa versus healthier fats, which were Slow, versus whole foods that contain healthy fats, which were Go. So that's kind of the basis behind our categorization of those foods. We also focused on 100% whole wheat. Now that the marketplace has more of those foods available, we wanted to bring attention to that. And then we moved fruit juice because with the emerging science, you have to be careful about recommending it as a Go food, which it was previously. So just going through each of the specific food categories, with vegetables it was mostly wording changes. So there really wasn't a lot to change. As I said before, vegetables are mostly healthy unless you have them fried and they ended up on the WOA list. So we really didn't need to make a lot of changes there. With fruits, we really made clear that the fruits that were GO had no added sugars. You'll see that in the next slide, so I'll show that to you there. 100% fruit juice was moved to the slow category, which is consistent with a lot of the recommendations that have come out now. We moved sherbet and sorbet to WOA foods because of the sugar content. We added smoothies, and they were based on GO, slow, or WOA, depending on how much whole fruit they had versus how much juice or sugar they had. And then we added fruit gummies and fruit snacks, which were in the WOA, which we placed in the WOA list. So here's an example. Again, this is something that y'all have seen previously, but I have the changes highlighted. So as you can see, a lot of the list remained the same, but we did make those specific tweaks. So in grains, we added 100% whole grain to teach the terminology. So that's consistent with the list. We ended up moving muffins, waffles, pancakes, and French toast to WOA, mostly because of the sugar content. I realize, for example, if I make those foods, they tend to be healthier at home because I'm watching fat content and fiber content. But in general, when kids see them or see them in the marketplace, they're not always the healthiest. So that's why we did that. Crackers were moved to slow. Animal and graham crackers were moved to slow. Again, kind of focusing on whole foods as our GO foods. And then cereal fruit bars with added sugar are WOA. What we find is kids are eating a lot of those with our data and kind of substituting them almost for cookies or other snacks. And sometimes they might even have more fat and sugar than some of these other foods. In the milk and dairy category, we moved unsweetened rice and almond milk to slow because of the low protein content. So we really were trying to kind of match the nutrient profile of the foods that are in GO. So soy milk remained on the GO list. Plain whole milk moved to slow, which was actually a lot of the feedback that we got on the GO, slow, and WOA list. All types of milk with added sugar were moved to the WOA list. All types of yogurt with added sugar were again moved to the WOA list, while unsweetened whole milk yogurt was moved to the slow list to be consistent with the plain whole milk. All cheese sauces and processed cheese were moved to WOA, again because of the processed status. And then all ice creams and frozen yogurts are WOA because of the sugar content. We did leave coconut milk as WOA because of the saturated fat content. So a lot of changes in the milk and dairy food category. In the meats, fish, poultry, and nuts, or the protein category, we moved nuts and natural peanut or nut butters with no added fats or sugar to the GO list. If those butters, nut butters, or peanut butter do have solid fat added, they were placed on the WOA list. We moved egg substitutes to slow because they're more processed than eggs themselves. Ground chicken and turkey breast we moved to GO. And then we moved all breaded chicken and turkey, including chicken nuggets, to WOA. So before we had distinguished between baked and fried, and we moved them all to WOA. Mostly because of the processed nature of the food. In the fats category, we deleted nonstick cooking spray. So with other foods then, we moved artificial sweeteners to WOA. For children, we still do not feel like those should be a regular part of their diet. There are exceptions, I understand, but for general use, we feel like those should be WOA. We also want to train children's palates so that they get used to foods that aren't sweet all of the time. So that's one part of the rationale behind that. We added salsa to go. I can't believe that we're here in Texas and we didn't have salsa on the list. I see that as an everyday food for me. So that was kind of amazing when we went back and looked at the list. I don't know how we missed that. We added natural sweeteners, things like stevia, to slow. We added dipping sauces to whoa because we got a lot of feedback from teachers and kids where they use dipping sauces, especially for chicken nuggets, and they didn't know where to place it. We also added more examples of types of sugar to the whoa list, so molasses, agave nectar, corn syrup, etc., so that kids could learn to recognize them. So a final change that we made is we added My Plate servings at the back of the Go Slow Whoa list so that people knew what the My Plate servings were to kind of get an idea of portion size. So whenever we do Go Slow and Whoa, we always get a lot of questions. So I thought I would address several of those up front. I'm sure y'all will have additional questions, but I thought some of these we could take care of right now. So one of the questions we get all the time is my child is allergic to peanuts, milk, other things as well. So the Go Slow and Whoa list doesn't work for them. So as I mentioned at the beginning, Go Slow and Whoa is meant to be a general eating pattern for the general public. So it needs to be adapted for children or other individuals that have special dietary needs. It was not intended to address everybody's dietary needs. So for example, you could eliminate peanuts or peanut butter for someone with a nut allergy. When it's adapted, we recommend that you use advice from your dietitian or your physician in doing that adaptation. I do want to point out, though, that we do have alternatives to peanuts, milk, etc. in the Go Slow and Whoa list for children who are allergic. So, for example, we have different types of milk on there, plant-based milk. We also have different kinds of nuts butter on there. So another question is, what about a keto diet, vegetarian diet, diet of the day, etc.? So there's a lot of different diets out there. Again, just to reiterate, Go Slow and Whoa is meant to be a general eating pattern for primary prevention. A lot of the principles that we base this on were on an optimal American type diet, which we would see as a DASH or a MIND diet. And the Mediterranean diets, as well as the latest nutrition research. So we were looking more at foods that fell into those categories. The Go Slow and Whoa list is also meant to encourage healthy eating patterns in children that allow for optimal growth and development. Several of these more restrictive diets are not appropriate for children unless they are under physician and or dietitian supervision. So a lot of these diets have not been thoroughly evaluated, especially long-term in children or adolescents. So we didn't feel like we could promote them in this. The other point I wanted to make is alternatives are in the Go Slow and Whoa list. So it's not intended that a person would eat all of the foods listed on Go Slow and Whoa, but it's more a menu of options that they can choose from. I don't like how milk, meat, yogurt, etc. is classified. So we get a lot of these questions about disagreement with the certain classifications of food. So as I mentioned previously, nutrition is very complicated, and much of the disagreement for placement of foods in Go Slow Whoa categories stems from two main factors. One is a person's own experiences with the foods, and or a misunderstanding about the concepts of portion size and frequency. So part of that too kind of depends on if you're on a special diet or not. So if you're on special kind of diet, certain foods might move up or down the list depending on that. Go slow and whoa categories are also based on the current nutritional science, as well as reviewed by several dietitians and nutrition experts. So we had quite a few people look at this list. Finally, these foods are classified for children's diets. So that might be different than how someone would see a food for an adult, for example. So what about portion sizes? So I think one thing that's important to emphasize is that the amount of food that is consumed is as important as the food category. So this is actually mentioned at the beginning of our Go Slow and Whoa list. So the exact statement says, although foods are categorized in this way, it's important to note that eating large quantities of foods can be unhealthy, even if they're Go foods. So we recognize that that's another reason why we put the My Plate portion sizes at the end, is kind of to emphasize that a fact. It's really hard when you have as many foods as you do on the list to come up with a specific portion size for every food. So that's kind of our rationale in terms of that. As mentioned in the Catch curriculum, though, we do talk about portion size, and we also talk about that children need to pay attention to cues when they're full. So they really need to pay attention to when they're full and stop eating. So some of the surrounding nutrition concepts for Go Slow and Whoa are actually found in the Catch curriculum itself. So what do you do about cultural food combination foods, other foods not on the list? As I mentioned in the beginning, foods are complex, and it's hard for us to represent every combination of food that there can be or every recipe. So the Go Slow and Whoa list doesn't include combination foods. So what we recommend for that is that you break down the food into its constituents. And so, for example, if a pizza is made of a crust, sauce, cheese, and toppings, you would look at each of those to see if those individual ingredients are Go Slow and Whoa, and then take that into consideration when deciding if that food is Go Slow or Whoa. So that really gives you an opportunity to look at those. However, we know that there are a lot of different foods in there, and new foods are coming out on the marketplace every day. So if there's a food that cannot be categorized in this way, please feel free to drop us an email, and we can help. Contact us at catch.org, and we will do our best to respond to that and provide updates as necessary. So before I end, I'd just like to acknowledge the many nutritionists who worked on this list, in addition to Joey, who will be talking in a few minutes. But Jerry Berry, as I said, did a lot of the legwork for this, and really her work was essential in putting this together. And then several of the nutritionists and doctoral students at the UT Health School of Public Health, Srila Sharma, Laura Moore, Amanda Reet, Jeannie Piga Plunkett, Wes McWhorter, Shannon Weston, Courtney Bird Williams, and then I also want to give a shout out to all the people who responded to our survey. We really appreciate y'all's input. I'm sure some of y'all are on the webinar today, and we really appreciate getting that feedback on what we've done. So, any questions?
Yeah, we've actually seen a few questions roll in. So if anyone has questions for Dr. Hoelscher, kind of related really to the science behind the Go Slow Whoa list updates, and kind of any nutrition related questions, this is a great time to ask those before we get into Joey's presentation about how this is kind of rolling out in Catch. And so I'll touch on some of the ones that have already come in. I don't know if I heard you mention this, but another staple of the Texas diet, the avocado, where does that fall? Because there's a lot of fat.
It's a Go.
But it's okay. And
it's healthy, natural.
Yeah, because it's, and I had mentioned that previously, that solid fats were Whoa, liquid fats fall in slow, and then foods with fat we had put on the Go list.
That's good. I see another one here from Jean, who's asking about pizza. I hope that answered your question, Jean. If not, about the combination foods, feel free to fire us another question. Christina says, isn't it inevitable to avoid all processed foods, as even whole grain breads and pastas are processed? Is that a correct assumption?
That is true. So in some of the categories, we did allow for some processing, we tried to minimize it as much as possible. If you really get down to it, there's a lot of processing done with our foods. We tried to especially minimize it if other ingredients were added, such as unhealthy fats or sugars.
Okay. Could you talk a little more about the decision, this is from Caitlin, about the decision to put flavored milk in the WOW category? She says she thinks it's important, especially since it's typically offered as a choice in school meal programs.
Yes, we chose to put it there because of the focus on sugar. So in terms of our nutrition philosophy, and I think I mentioned it, we really think it's important for kids to get used to tasting foods in their natural state. So without sugar. There's sugar added to a lot of different foods. One of the concerns with flavored milk is when you do have sugar added to our beverages in general that are flavored and sweetened, you can tend to drink a lot of them because the volume doesn't register as well. So given that and the sugar in it, and really if you look at the calories, sometimes the calories are almost as much if you have a low-fat flavored milk as in whole milk. So not all the time, it depends on the percent fat. But because of the sugar content and because of the focus on sweetened beverages, we moved it to WOW.
Great. So I've got a few just kind of specific foods, so I'm going to kind of run through these quickly. How about pancakes, waffles, and French toast made with whole grain flour? Is that still a WOW?
With those, I think you have to kind of look at them and see how you adapt them. So in general, like I said, we can't address every food that's in the market or every recipe that's out there. In general, if you go to a restaurant, for example, and you have a choice of waffles or pancakes, they're likely to have a lot of fat. You add a lot of fat to them. If you're making them at home, if you're watching your fiber content, your fat content, your sugar content, they easily can move down the list. As I said before, you have to give a rationale for why that's happening.
And I think with those particular foods, I think some of the rationale was you eat those foods with added sugar
Syrup,
most
you
of
mean
the time.
butter and syrup and things?
Yes.
Right. Okay. So speaking of a new food a week, how'd you categorize Beyond Burgers or the Impossible Burgers?
I don't think that they're on the list currently because at the time we were developing this, they hadn't come out. So that's a really good suggestion. We can go back and look at them. If anybody has suggestions, just send them on and we'll consider them as we decide to put them on here.
There you go. Yep. Bethany asks here, and again, I think this is still just kind of going at the same thing of you can change anything from go, you can take it down to slow, but she says lots of salsas in a jar have added sugar. So does that affect, basically where salsa is going to fall?
Yeah, ideally you would look for one that didn't have added sugars in it as a go.
Yeah, fresh salsa, definitely more prevalent in some states than others.
Yes.
This one's a question about, many kids will not eat plain low-fat yogurt. So if we are avoiding adding sugar and flavors to yogurt, what is, a healthy option for yogurt?
Well, a lot of times you can chop up fresh fruit and put it in there. That's very, you can get kids to eat it that way. The other thing is you can add seasonings like cinnamon. A lot of times adds kind of a sweet flavor to it, especially if you combine the fruit and the cinnamon. If the kids are eating, kids have a natural affinity for sweet. So, they're going to go that way if you give them sweet foods. They can get used to foods that are less sweet. If they've been eating very sugary yogurts, you might have to kind of titrate them down. So maybe you go to a Greek yogurt that has less sugar before you go all the way to a yogurt with no added sugar.
Great. There's one more, and this might fall kind of as a hybrid question for both you and Joey, asking, can preschool age children learn the concept of slow? I know that that's not part of the preschool curriculum. It's just Go and Whoa, correct?
Correct. That's the exact reason why we collapse the Go and Slow into one category at that age level, because it's a little bit too hard for them to distinguish between the three. I still have problems.
Yeah.
Yeah, so again, because we are dealing with children, that's our primary audience here, you have to follow the developmental level of kids. And so these concepts you have to introduce one at a time. And as the kids get older, you expand what they can learn.
Exactly.
Okay. So Penny Edwards asks, we talked a lot about sugar today, but where does the conversation start with increased sodium? Salsa, again, everyone's picking on salsa. Salsa is usually paired with corn chips full of sodium. So is there any thought about the sodium content?
In general, most of the sodium in the diet comes from processed foods. So if you have the processed foods in Whoa, that's where most of your sodium's going to fall. Okay. So I think that's how the Go Slow and Whoa list addresses a lot of that, is with the processed foods kind of going up the list.
And we also have lessons in the Catch curriculum that address sodium.
Great. Well, and I've seen a lot of questions come in here. Continue to type them in, folks. We'll have more time for Q&A. I want to make sure we have enough for Joey to go through the changes in the curriculum. But many people asked, is the new list online? Where do you get the new list? And Joey's going to go into exactly that right now. So, Joey, let's take it away with how all of this is playing out in the Catch program materials.
All right. Thanks, Brooks. Thanks, Deanna. Really excited to talk to everybody about this, because it is a concept that's so integral in the Catch family of programs and materials. For my part, for the next few minutes, I want to highlight where we are with the curriculum updates that have been made and are still taking place as a result of all these changes to the list. First, all the science and data that went into informing the updates that Deanna just described for the list is now being reflected in all the Catch materials, from early childhood, elementary, and middle school, the coordination kit, and to the after-school program. And Catch.org is going to be your go-to place to get all the lesson updates, as well as some downloadable resources to help you navigate those changes. Before we get into the details of where we are with the updates, I want to let everyone know that we have some immediate takeaways for you. We have created a Go Slow and Whoa update summary page that highlights the changes to the list. It's available now in English and Spanish at the link on the bottom of the slide. Now, don't try to scramble and jot the website down. Don't worry. We'll send you a link to this page following this webinar. Plus, it'll appear in a couple more slides as we go along. This page will be a repository of Go Slow and Whoa update information, as well as free downloadable resources. Included on this page is the new Go Slow Whoa list in English and in Spanish. The one-pager, along with the new list, will be your key takeaways to help you navigate the changes that Deanna just went through. As many of you probably know, Go Slow and Whoa is a fundamental piece of our coordinating language that permeates throughout the Catch family of programs and materials. This means that very few lessons and materials were left untouched by these changes. But in many cases, the changes were relatively subtle. I'll go over some of the examples of the subtle changes, as well as highlight where significant updates were needed. Now, when we say that the Go Slow Whoa updates affected all the Catch family of programs, we don't want anybody to panic and think that they have to relearn Catch or using Go Slow Whoa or teaching Go Slow Whoa to kids. Think about it this way. Let's say, for example, the speed limit for school zones was going to change from 20 miles an hour to 18 miles an hour. Now, that wouldn't mean you would have to go take a new driver's test, relearn how to drive. It wouldn't necessarily substantially affect your commute if you happen to drive through a school zone, but it would create a ripple effect of changes that most people would experience. For a start, all school zone signs would have to be updated and reposted to reflect the change. Drivers would also have to be aware of the change and adjust their speed accordingly, and so forth. And of course, if you taught driver's ed, then you would definitely need to know the speed change so that you could instruct your students about the correct speed limit. So, with the Go Slow Whoa updates, you don't have to completely relearn how you teach and encourage kids to make healthy food choices but you should be aware of the changes and adjust your messaging to kids accordingly. That being said, we realize that not everyone will have immediate access to the updates, so we want to reassure you that you aren't going to be doing harm to kids if you continue to use the old list in the interim until you can obtain the updated material. As much as possible, though, we would encourage folks to use the updated materials and list and make plans to get the updated material. What I'll outline now is where we stand with the updates to all the Catch materials and the timeline for the few items that remain, plus highlight what we have to offer to make this transition easier for folks. Our priority as we came into August and September at the start of a new school year was the school program materials, so let's start there. Currently, all the necessary revisions and updates to the K through 5, 6 through 8 coordination kit and the Go Slow Whoa PE cards have been completed and are available on catch.org. For the health lessons, this includes the lesson content itself, plus the student and family materials. Additionally, the first half of the new K-8 PowerPoints, which are available exclusively on catch.org, have been updated as well, with the remaining PowerPoints coming by the end of the year. If you are interested in obtaining an updated print or hard copy of the curriculum manuals for the K-8 lessons, those will be available soon via our partners at Flaghouse. We are looking at this month for the 6 through 8 manuals and by the end of the year for the K-5 manuals. For the coordination kit materials, they were only minimally affected by the updates, and the specific resources involved were the Go Slow Whoa Eat Smart posters and the Our Catch School Go and Slow Snack Suggestions flyer. Those have been updated and are now available as a free supplement download on catch.org for anyone who has and is using the coordination kit. For any orders coming in now for the coordination kit, a shrink-wrap set of the new posters will be included in your order. Additional posters can be downloaded and printed via the free digital copy that's going to be on catch.org. Even PE didn't escape the nutrition changes from Go Slow Whoa updates. These were affected because of the Go Slow Whoa Eat Smart Games section in the blue 3 through 5 activity box. The Go Slow Whoa PE cards that accompany some of those games in that section have been updated directly in the activity packs on catch.org and are also available as a free PDF supplement download on catch.org for those wishing to print and supplement the physical copies in their boxes. Once the 3 through 5 activity box cards are reprinted and the new Go Slow Whoa cards will be included. Finally, for the school materials, any reference in the lessons to the list now has links to that updated list. The complete Go Slow Whoa list itself is available as a free standalone download on the Go Slow Whoa page I mentioned at the start. The K-8 lessons and material updates have kept us busy this summer in order to be ready for the school year, so we are now plugging away at updating the rest of the Catch program materials, including the Catch Early Childhood lessons and manual. Those updates are scheduled to be completed early next month. The Catch.org lesson updates will be complete, and we will also offer a free download to guide those of you with a hard copy manual to those lesson updates. The primary reason for this is because the updates were not as extensive compared with the school lessons, since we only use Go and Whoa food categories at this level. For those of you in the after-school arena, the updates to those lessons will be completed by the end of this calendar year, and we will roll them out on catch.org and in print in January. Additionally, there are some supplemental resources folks might be interested in. First, the Go Slow Whoa one-pager I mentioned earlier with an overview of some of the information presented here and highlighting the key changes to the list. And second, for anyone who would like the larger Go Slow Whoa posters that have been available through Flaghouse, those updates to the posters have been made, and the new posters will be available to order in November. Okay, as I mentioned previously, Catch.org is going to be your go-to location to get the most up-to-date information, resources, and lessons. An advantage of the digital platform is that we are able to update and make content available quickly. If you already have a subscription to Catch.org, the updated content will be there ready for you to use. If you use or teach from the Catch materials, all the changes will be on the site, so all you have to do is follow the lessons or other material that you're using. If you don't have a subscription to Catch.org, perhaps now is a good time to consider getting one. Along with getting all the updates seamlessly, we have also added other content that is useful, such as the addition of the PowerPoints for the K-8 lessons. For those folks that don't have a subscription to the site and may not be able to get one quickly, use the Go Slow Whoa list and the one-pager provided as a guide to those key changes, as well as taking advantage of the various free downloads available. Next, what I want to do is take a minute to highlight a few examples of how the updates to the list are reflected in the actual lesson content. For the most part, many of the updates are small wording changes. For instance, almost every time sugar is mentioned, it will be identified as added sugars unless the sugar is naturally occurring. Again, due to all the reasons that Deanna just walked us through. Similarly, whenever fat is discussed, it will be further clarified by the type of fat, such as a solid unhealthy fat, or a more healthful liquid fat, or a healthy fat, and so forth. Additionally, all the lessons regarding sodium and salt have been updated with the current dietary guidelines for Americans, so in those lessons and references, the changes were mostly numerical. These are just some of the examples of the relatively smaller changes, but ones that were necessitated updates throughout the lessons due to the numerous references to things like sugar, fat, and sodium. Another update that required some revisions but wasn't widespread is the emphasis on whole and minimally processed foods versus the processed and ultra-processed foods. The previous list, as Deanna described, already had this as a focal point, but since it's been emphasized a bit more, it required some additional changes. So some of the common food examples we use in the curriculum required updating. For example, animal and all crackers for that matter have been moved to the slow foods. Along the lines of food examples, other somewhat small updates relate to any time a food is mentioned and referenced as a go, slow, or a whoa food. Obviously, we had to go through all of them to ensure that that reference was still accurate, and if it wasn't, revise it so that it would be accurate and reflect the new list. For example, in some of the stories, if a go snack was mentioned, a lot of the time graham crackers was used. So obviously that had to be changed since it's now a slow food, and now you might see something like carrot sticks instead. For the most part, changes like these don't fundamentally change the lesson or the concept that you're teaching. In fact, some of these minor updates wouldn't be noticed if users are simply following the lessons, reading a story, using the PowerPoints, etc. Now, there are a few lessons that were substantially affected by the updates. In particular, the lessons pertaining to go drinks. Because 100% fruit juice has been moved to the slow list, it limits the number and types of drinks that we highlight as go drinks. When you get down to it, the main go drinks left for kids are water and plain low-fat milk. So that particular lesson, which is an early childhood lesson, by the way, is one that was affected in a bigger way and required more substantial rewriting and revisions. Okie dokie. To wrap up and to get to any other questions folks might have, please remember to visit Catch.org as the remaining updates will be rolled out in the next few months, with all Catch.org content scheduled for completion before the end of this year. Also, remember to check out the dedicated Go Slow Whoa page on the site, which will be that repository for Go Slow Whoa information and downloadable resources. Finally, we will be including a link to this recorded webinar on that page as well, and on the MSD Center's webpage also. Whew, I think that's about it for now.
All right. Well, thank you so much, both of you, for your presentations here today. We will open it up for questions with the time we have left. There haven't been that many that have come in about the materials, but beyond asking, is the list available online, which it is on catch.org. We put the link there again on this thank you page so you can see it. I believe it should be out on our social media platforms as well, too. So if you follow us on Twitter or have liked our page on Facebook, you can grab the links there. If you don't follow us on social media, go ahead and do that. Let's see. This question from Erica asks, where can we find quantitative information on the impact that Go Slow Wo has had so far? So maybe some of the evidence behind, using Go Slow Wo as an education tool for kids.
Yeah, there is a validation paper that we didn't do. Actually, another group did, and I think it's posted on the Catch references, but we can send it out. Other than that, the other evidence that kind of lies behind Go Slow and Wo are some of the studies that we've done. Catch Travis County, where we saw a drop in obesity rates, the El Paso study where we saw a drop in obesity rates. So those are kind of the evidence that we have for what we have been doing.
Great. And if you go to the catchinfo.org website, you can find links to the research articles, some of those that Dr. Hoelscher is mentioning, as well as other kind of links to our evidence base for the program itself. This question was submitted by Rachel. We've got lots of people who have asked about specific foods, but how would you categorize whole grain rich items, those made up of at least 50% whole grains, such as those served at schools?
I think it depends on the items. So we classified mostly 100% whole grain as Go. So those would, depending on the percentage of whole grain, I think that you could probably look at them going in either the Slow or the Go, depending on where that percentage is.
Okay. Let's see. A lot of people have questions about specific foods. I think it's going to be best to follow up with those via email. I'm looking for other ones about. So yes, to answer Lauren your question, the curriculum is online on catch.org. You can find information about all the different kind of offerings and grade groups and grade bands that we have for Catch with the nutrition education. You should be able to find information on that again at catch.org. The list is online. There's the link there, and that will have the archive of the webinar, and these slides will also be included as part of that archive. It'll be on the Catch.org site and also on the msdcenter.org website too. So at the UT Health Research Center, they will have a copy of this online as well. Well, thank you everyone for attending. Thank you to our wonderful speakers. We really think this was obviously a very popular topic, and we will continue to answer any questions about Go Slow Wo, and maybe we'll be doing this again if we have enough people that would like to kind of learn more. So thanks everyone for attending today. We hope you enjoyed it. Have a wonderful rest of your day. Take care.